Hi, my name is Brianna. I'm a fourth-year nursing student at Cedar Crest College. The topic that I chose for my evidence-based research project was non-pharmacological pain management in neonates. I became interested in this topic because I would like to be a neonatal nurse when I graduate, and also I believe that there are many other ways to control pain other than pharmaceutical interventions. My official PICO question was, in neonates undergoing a painful procedure, does the use of non-pharmacological pain management interventions compared to standardized care decrease the neonate's perceived pain? There are many reasons why this is very significant to nursing. One of the biggest reasons is that pain management is a daily task, and controlling pain is very important to nursing because nurses deal with this on a daily basis. They need to make sure that their patients are as comfortable as possible, and pain management is one of those comfort techniques. Researchers are also finding that pain management in neonates is decreasing the likelihood of negative effects later on in life. Some of these negative effects are hormonal imbalances, anxiety disorders, decreased neuronal or brain development, and also a decreased tolerance for pain. Another significant reason is that this it improves positive outcomes during a painful procedure. For these reasons, it's really important to try to control neonatal pain. So for my literature search, I used Medline search engine. I used the phrase non-pharmacological pain management in neonates. I then narrowed it down by selecting 2008 to 2016 and also peer-reviewed articles. I came across 24 of those articles and I chose one. I then moved on to EBSCOhost full text finder. It gave me 61 nursing journals. I narrowed this down by using the keyword neonate and also pain. And of the journals that this gave me, I was able to look through 2008 to 2016 again, and I chose two of the articles from the journals that I looked through. The first article that I chose was by Gao et al., and they were interested in the effect of kangaroo mother care or skin-to-skin contact in neonates during a painful procedure. There was 80 neonates, 40 of which received kangaroo mother care, 40 of which did not. They were looking at facial grimacing, heart rate, and crying during the painful procedure. They found that the neonates with skin-to-skin contact had significantly less facial grimacing, less crying, and a more stabilized heart rate than those who did not have the skin-to-skin contact. This proves that it's a very good non-pharmacological technique to use for neonates. The next article that I looked at was by Siddhartha Soni, Negarenda, and Mahavihiti. They studied the effect of a familiar scent, a familiar vanillin scent, and they wanted to look at heart rate, O2 saturation, and crying. So the neonates that received the vanillin scent the night before and were familiarized with it during the night, they had that during the procedure. They had a better outcome, less facial or less crying than the neonates who did not have any kind of vanillin scent, and the neonates who were introduced to the vanillin scent right before the procedure. They found, though, that there was not a big difference in the neonates' heart rate or O2 saturation. It was pretty much all the same, but it was still a good technique to use. Baba, McGrath, and Liu wanted to study the effects of mechanical vibration before a heel stick in neonates. They found that the 10 neonates in the group with the mechanical vibration had significantly less crying, less facial grimacing, less movement, and better breathing patterns than the neonates that did not have the mechanical vibration right before the heel stick. So this is also a very good non-pharmacological pain measure to use. So because of the results of these studies, nurses and nurse and parent teaching, as well as incorporating non-pharmacological techniques in with standardized care, are recommended because of the results of this study showing that there is a better controlled pain in neonates. Also, based on the results of this study, it can be concluded that the use of non-pharmacological interventions can improve the outcome of short, painful procedures, and therefore possibly reducing negative consequences later on in life. So this was my topic. I was very interested in it, and I hope that you all are too. This is my poster. I am looking forward to discussing it with you.